Hi, this video is the demonstration of the strip hair transplant scar on an African American client. And the audience wants to know what a hair transplant scar look like. I mean, I've shown a video for FUE scar multiple times, where FUE scar have tiny dots of scar scattered throughout the back like mosaic pattern, allow you to shave your head short. The strip hair transplant scar is a linear scar, and that scar will be visible if you cut your hair short, but if you leave your hair long, you can hide it. I do both FUE and the strip method, or they call it FUT. And it'd be fair to show both the FUE and the FUT scar. Because the FUE is the more advanced technology. It leaves you tiny dots of scar, allow you to wear your hair shorter. The FUE is less invasive, less bleeding, less chance of infection, and less painful during recovery. But however, no surgery technique are perfect. The FUE has its limitation. There's pro and con, and the con of the FUE are, number one, it's more expensive than the strip method. Number two, we cannot do a big case. The FUE can do up to 25 to 3,000 grafts per day, which is around half of the head, and not beside the cost and the number of grafts, but the growth rate is pretty much comparable. The FUE and FUT can give you very good result, but the FUE is around 5% to 10% less than the strip method. But here's the strip method again to have its pro and con. The strip is more invasive, has linear scar. You need to wear your hair longer to hide it, and more painful. But again, it's not that painful relatively to FUE, yes, but it itself is a minimally invasive surgery. That's why we do outpatient and go home. And you have numbness along the linear scar, but not the whole scalp. And but those are the con of the strip method. But here's the pro. Number one, the strip method is cheaper. Sometimes it's 50%. We can do a large number of grafts per day, where you can class my advanced hair loss, like class 5, 6, or 7, where you need to move 5,000-6,000 grafts per day. That's very helpful. And so it's very good and recommended for advanced hair loss. The other thing is it grows 10% better than the FUE.